Dr. Martino, if I decide to get a chemo, what's the side effect? Am I going to lose my hair? What's going to happen to my bones? Am I be able to function, to go back to work? Am I going to function on any routine every day?
The type of side effects that occur with chemotherapy are somewhat specific to what drugs one uses. Some drugs are harsher than others. Okay. But in general, a good way to understand most, but not all of the side effects of chemotherapy is to understand that chemotherapy drugs are most effective in killing and damaging cells that are trying to divide. That's what you want in terms of killing the cancer cells, because cancer cells tend to divide more rapidly. But if you think of your own body and mine, there are certain parts of us that are actually growing and other parts of us that are just sitting there doing their jobs. For example, hair actually grows. And because hair grows, that's why it often is damaged from chemotherapy. So what often will happen is that usually after the first dose, about 2 to 3 weeks after the very first dose of chemotherapy, the hair will fall off. Okay? And for most people, they will lose pretty much all of the hair on their head, so that it is wise to get a wig before the hair falls off. Okay? The hair always grows back. It'll start to grow back about 2 to 3 months from the very last chemotherapy treatment. When it grows back, it sometimes is curly for a while. And then as the hair grows and as you cut it, you will lose your curls and your own hair will come back. You'll tend to thin hair in other parts of your body, like your eyebrows and your eyelashes. Those will also tend to thin, but the hair that'll bother you the most is the hair on the head. Okay? With some chemotherapy drugs, you'll get a little tearing of the eyes. The eyes will get a little bit irritated. That's temporary. Sometimes you'll get little sores in the mouth, like cold sores or fever blisters. Nausea and vomiting is very personal. It has a lot to do with what drugs one uses, and also with the person. Some people are more vulnerable to nausea and vomiting, and many people are not. So it is not something that happens with everybody. Some people are more prone to getting maybe a little constipation, a little diarrhea, some cramping in their belly. The fingernails, which is another part of the body that tends to grow, oftentimes are affected. So sometimes their color will change a little bit, or you'll get these funny little marks on the fingernails. All of that will grow out as the nails themselves grow out. Probably the most important part of side effects, and the part that your doctor worries about, is not so much your hair or your nails. That's the part you tend to worry about. What your doctor worries about are your blood counts. Okay? And blood counts refer to the blood cells that are made in your bone marrow, which is the center of your bones. There are 3 important parts to your blood products. There are the white cells, which is what fights infections for us. There are the red cells, which is what give us most of our sense of energy. And then there are the platelets, which are what help us clot if we cut ourselves. All of these are decreased by chemotherapy. The ones that are most vulnerable, however, are the white cells, the ones that fight infection. Okay? So that the reason why chemotherapy can't be given every day, but you must allow a certain time, like 2 or 3 weeks, between each dose is because the blood counts will naturally go down. The body has to rebuild them so that the next dose can then be safely given. And depending on how low the blood counts go, many doctors, myself included, will use certain products to help keep your blood counts more normal so that you're less likely to get infected. Okay? The other thing that I think is common to most chemotherapies is that your energy level is not your usual. Chemotherapy is not a picnic, okay? But these are the kinds of therapies where you can go about your business. You can work, you can be in public, you don't have to be hiding. You don't have to be afraid of other people. You do have to avoid, as best as you can, people that are clearly infected, people that have colds, that are coughing at you, okay? But none of these are the kinds of therapies where you can't function, where you have to be in bed, where you have to be protected. These are therapies that allow you to, for the most part, just go about your business. There clearly will be days where you don't feel so great, and then there'll be other days where you feel just fine. Okay? You'll have to learn how to be respectful of your body on those days where you don't feel well, where your energy level is down, or when your stomach might be a little upset. You need to be kind to yourself and learn how to say no to people who put a lot of demands on you, okay? Because your energy will be somewhat lessened. But again, the point I want to stress to you is go about your business. You will be fine.
Mentally, how I'm going to function?
Well, how you're going to function mentally is really remarkably up to you, okay? This is certainly not the easiest time of your life. No one sort of ignores all of this, okay? This is a big, difficult, emotional set of circumstances that not only you, but your family and your friends will be going through. So to think that you would be going through this being joyous, okay, I think is unrealistic. You have to realize that, yes, you are very likely to have days where you are very depressed and don't feel so great. And then you'll have other days where you realize that you actually are going to go through this, you're going to get done with this, and your life is going to get back to normal. And for many people, I actually find that their life actually gets better after this because they learn certain important things. They come to realize that, like all of us, they are vulnerable, and that all of us are on this earth for the grace of God. And I think an experience like this reminds you of these things and makes it even more meaningful to look at your children and enjoy their faces, and to look at your friends and realize that you have friends, and realize that you're here and that you have a life ahead of you that requires you to do things that are important. So I actually think that for many people, even though this is not an easy experience, but it often makes them better people.